So let us take the first question. Which of the following structures in the scapula is palpable in the infraclavicular fossa? This picture is given where A shows the infraglenoid tubercle, B is the acromion process, C is the coracoid process, and D is inferior angle of scapula. And the question is asking about the infraclavicular fossa, that is below the clavicle, and which part is palpable among these. So we know that tip of coracoid process is palpable, so answer will be C, because we know tip of coracoid process C. That is correct answer. Moving to next question. In pemphigus vulgaris, autoantibodies are formed against which cell adhesion molecules? To solve this question, we need to understand this is the basement membrane, this is the cell, this is another cell, and in between cells we have this desmosomes present, and this is cell adhesions molecule. Cell adhesions molecule. This cell adhesion molecules, cell adhesion molecule for desmosome it is cadherin. So the answer to this question in pemphigus, because the given condition is pemphigus vulgaris, so the answer will be cadherin, because this is against desmosome. But if we see bullous pemphigoides, in case of bullous, the antibody will be against hemidesmosome. Now hemidesmosome is located here. That means cells between cells and basement membrane. So in case of bullous, the antibody will be against hemidesmosome. And the picture will be like this. Next question. Development of diaphragm begins at 4 weeks of gestation, and diaphragm has contribution from different structures, and out of these structures central tendon develops from what? These are different structures which give rise to 4 structures. So dorsal mesoesophagus or the dorsal mesentery of esophagus, dorsal mesentery of esophagus, it forms crura of the diaphragm. It forms crura of the diaphragm. Septum transversum, it forms central tendon. Then pleuroperitoneal membrane, it forms small peripheral part. Small peripheral part, and cervical myotomes, that is the mesoderm of the body wall, cervical myotome, it forms a large peripheral part. So these are the contributions from different parts. Question says about the central tendon. So the answer will be septum transversum. Next question is 29-year-old man presents with duodenal peptic ulcer. Complains of epigastric pain. Which structure harbors the cell body of abdominal pain fibers? Now abdominal pain fibers, visceral pain fibers is carried by the visceral efferents. So all these visceral efferents, they are present in the dorsal root ganglion. Dorsal root ganglion. So dorsal root ganglion is the area for efferent fibers. What about lateral horn of the spinal cord? Lateral horn of the spinal cord is concerned with the sympathetic preganglionic nerve fibers. What about anterior horn? Anterior horn is always concerned with the motor activity. So this is concerned with the efferent fibers, efferent. And sympathetic chain ganglion. Sympathetic chain ganglion, as we know, that contains the sympathetic postganglion fibers. Sympathetic, for sympathetic. Most of the time relay is there. Sometimes relay may not be there, but most of the time in the chain of ganglia, sympathetic fibers, preganglionic fibers are going to relay, so it contains sympathetic postganglionic fibers. Question is asking about the abdominal pain fibers, cell bodies. Answer will be C. Musculophrenic artery gave rise to, you see, anterior intercostal artery, anterior intercostal artery is a branch of internal thoracic artery which divides into two. This is internal thoracic artery, internal thoracic artery. It supplies anterior intercostal artery in 1 to 6 intercostal spaces. This branch is superior epigastric, superior epigastric, and this branch is musculophrenic. Which supplies in 7 to 9 intercostal spaces. So the answer will be anterior intercostal arteries for intercostal spaces 7 to 9. What about posterior intercostal arteries from space 3 to 11? These are coming from descending thoracic aorta. Next question is 35-year-old woman presents with abdominal tenderness and acute pain. On examination, her physician observes that abdominal infection has spread retroperitoneally. This is important. Which of the following structure is most likely affected? Now we know that stomach is having peritoneal membrane, that is omentum. Transverse colon, transverse mesocolon is present, okay, and for jejunum mesentery is there. These three are covered by peritoneum, so these are peritoneal structures. Only option is which is retroperitoneal. Retroperitoneal is descending colon, so the answer will be descending colon. Which of the following bones articulates with the fibula, tibia, calcaneus, and navicular. This is the key bone. This is direct question. Direct question asking about talus. 29-year-old man comes in with the stab wound, cannot raise his arm above horizontal and exhibits a condition known as winged scapula. This winged scapula is important. Winging of scapula is there. Cannot raise his arm above horizontal is there. Okay. So which of the following structure will most likely be damaged? Medial cord, posterior cord, lower trunk and roots. Now you see winged scapula is because of paralysis of the serratus anterior muscle. And serratus anterior paralysis, serratus anterior is supplied by long thoracic nerve. Long thoracic nerve, it comes from the roots. It comes from the roots. C5, C6 and C7. So the correct answer will be roots here. Next question. Which type of gland is depicted here? Now you see given picture is of skin. We can see the hair follicle is present. Okay. And these are the sebaceous glands which are shown here. Look at the distance, it is not much far and the ducts are smaller. In case of sweat glands are quite deeper. Okay, so this is sebaceous glands. Sebaceous glands. So the answer will be holocrine gland because sebaceous are holocrine type of gland. If this give the picture of sweat, then it will be eccrine gland or merocrine. Sebaceous are holocrine. Next question. Example of traction epiphysis. Now we see all the choices. First is os trigonum. We know that os trigonum is what? Os trigonum is atavistic. Os trigonum is atavistic. Again, coracoid process is atavistic. Head of femur is articular. It takes part in the joint formation, so it has to be pressure epiphysis. Tibial tuberosity, any tuberosity, tubercle, trochanter which are non-articular, this is example of traction where the muscle is attached and it keeps on pulling. So the answer to this question will be tibial tuberosity. Next question. All of the following statements correctly apply to bronchopulmonary segment. So it is asking about the characteristic features of the bronchopulmonary segment. Only one of the following is not a feature. First, it is separated from adjacent segments by connective tissue septa. Yes, it is a pyramidal shaped space which is separated by connective tissue septa. That is correct. It is largest subdivision of a lobe. Yes, this is largest subdivision of a lobe. It is not resectable. This is wrong because this is resectable. It is named according to the segmental bronchus supplying it. This is also correct. So the answer to this question becomes it is not resectable because this is resectable. Resectable. Next question. Dorsal pancreatic bud does not form one of the following. So remember ventral pancreatic bud, it forms lower part of head and uncinate process. Dorsal pancreatic bud, it gives rise to rest of the structure. So uncinate process coming from the ventral, so answer will be uncinate process. Head, upper part, partial upper part of the head is formed by dorsal pancreatic bud, so that is considered here. Neck will be formed, body will be formed. Okay. If we change the choices, then if we change uncinate process with tail, then most appropriate choice will be head, because one half is formed by dorsal pancreatic. Anyway, in this question, it is a direct question, and uncinate process is the correct answer. Inferior rectal artery is a branch of. Now we need to understand that rectal artery are three arteries: superior rectal artery, in middle rectal artery, and inferior rectal artery. Superior rectal artery is a branch of inferior mesenteric artery. Middle rectal artery is a branch of anterior division of internal iliac artery. And inferior rectal is branch of internal pudendal artery. Internal pudendal artery. This is answer C is correct. This is a direct question asking about medial crest of fibula relation. Now we need answer to this question is peroneal artery, that is direct, and peroneal artery is the nutrient artery of this bone. Peroneal artery is the nutrient artery here. Peroneal artery, mostly it is branch of posterior tibial. Posterior tibial. Sometimes may come from, sometimes branch of popliteal. With respect to fibula, we need to understand 2 points. One is medial crest of fibula, that is related with peroneal artery. The other is neck of fibula. Neck of fibula, which is related to common peroneal nerve. Next question. Extraembryonic mesoderm is derived from primary yolk sac, secondary yolk sac, epiblast and hypoblast. In these choices, primary yolk sac is the best choice. If primary yolk sac is not in the option, then we can go with the hypoblast also, because hypoblast forms the cell lining of the primary yolk sac. So primary yolk sac, A is better choice than D.